so the last discussion we had on controlling static control in the healthcare environment, we talked about the risks that a healthcare facility would face due to static and static discharges. In this presentation, I want to talk about some of the things that you can do about it. Again, this goes back to the work that the ESDA, in particular Work Group 29, is doing to prepare a guidance document to help healthcare facilities identify the risks and control them. So this is just a quick overview of some of the basic things that will be presented and discussed, and some of the things that a healthcare facility can do. And again, as a reminder to that last presentation, the things that you do in a healthcare facility are going to be fairly different than the things you would do in a manufacturing environment, because it's much less controlled and the level of risk and the amount of static control that's required is lower. And so there are some very effective things that can be implemented in a healthcare setting. The first one is flooring. And again, in a manufacturing environment, you'd require a fairly controlled flooring material that would have essentially an electrical connection between the person and the floor to ensure the lowest levels of static buildup on a person. In this case, that's not necessarily the requirement. We're really trying to limit charge buildup to under a few thousand volts, and in electronics manufacturing, you want to limit it to below 100 volts. So it's a very different phenomenon. But just having a good static control flooring material can help minimize charge buildup on a person to below that 2000 volt level and help prevent some of the risks that we had presented in our last presentation. Couple things about controlling static. There are sort of two things you address. One is limiting the amount of static that gets generated, and the other is taking away any static that is generated. The flooring can do both. And so there are different types of flooring. The document that we're preparing will describe the different types and how they address those two different things. So there are materials that limit generation. They don't necessarily take charge away, but they keep it from building up and from generating in the first place to a point where you don't get shocks on people. And then there are floors that will actually take away charge. So those work a little bit, I don't want to say better, but more, and they can be used as well. Using a good, what we call grounded, so that's taking charge away, flooring that limits charge generation and takes it away is really the optimal solution. But again, there are other options in flooring to do both. The second thing you can do in a healthcare facility is use static protective seating. It's most effective when you have a static protective floor, because the seating, again, it'll do two things. It will limit charge generation due to the materials it's made from. But if it's connected electrically to a grounded floor, then the charge will leave the person through the seat. A good ESD seat will do both. It will have a connection to the floor. Often it's a simple little chain that drags from the frame of the chair and drags along the floor. And if it's a static control grounded floor, the charge would go through the chain into the floor and then to ground. So good, and they call it, often referred to ESD seating. It's really static protective seating. And there are different vendors in the market that make good products that will help eliminate charge. And the seating would be used, we would, kind of think about wherever you might have a risk. So if a doctor is in a seat performing a procedure, it might be helpful to have this type of seating so that he doesn't get shocked, or she, and flinch and cause a disruption to the procedure. Or if it's an area where you do a lot of data transfer and input, limiting the static generated on the person with a good static protective seat will help minimize the risk of having a data disruption when you're transferring that data or managing your computer systems. The third thing you can do is you can ground equipment. And by this, I mean things as simple as beds or things like the IV stands. In a lot of hospitals, you will see this if you look. You'll see hospital beds that have drag chains, as I described earlier with the seating, little chains that are dragging on the floor. Now, if you don't have a grounded static protective floor, that drag chain is not doing very much. But the concept is that if you can ground that equipment, then any charge that might get transferred from, say, a person builds up a charge, they touch that equipment, the the charge gets transferred to that equipment. If the equipment's grounded, it'll go to ground. It won't build up. You don't really want a charge building up on these devices. And again, a device could be a hospital bed. So just general grounding is a very effective strategy. Not complicated, really not costly. The fourth thing that we talk about is using what I call low charging materials. And as I mentioned, there are two things you do when you control static electricity. You prevent it from building in the first place, and you take it away. Low charging materials prevent it from building in the first place. And in these instances, we're talking about things like, wipes, simple, cleaning wipes that are made from a polyester material are static generating. There are versions of those that are made with different materials or have additives that reduce the amount of charge it's generating. So when you're wiping something with a conventional wipe, you're actually generating static. With a low charging wipe, you're going to generate a lot less. There are also coatings you can apply to things like bedding that will reduce the amount of charges generated. As many of you know, making your own beds at home, you're moving your sheets, putting them on the bed, and you get sparks. I mean, it's kind of fun to watch in the wintertime, but you really don't want that happening in a healthcare environment. And so you can buy sheets that are made with low charging materials. You can also spray them with or low charging, what they're called anti-static sprays that will reduce the amount of charge that's generated when you're handling those materials. So that's another mitigation strategy. This next one is called ionization. It's basically a device that floods an area with ions, and it will offset or neutralize static charge. That's a very simplistic definition of what they do. The document will describe it in much more detail and how they work and what these machines are. But they're one sort of word of caution. Some people believe that you can use an ionizer to flood an entire room to neutralize shock or static charge buildup in that entire area. And that's really not how they work. They're very spot types of things. They have to be fairly close to the thing you're trying to neutralize. Where they can be very effective in a healthcare setting is at the entrance to say a surgical suite. People will be coming into that suite. They may be carrying a charge on them, and as they go through the entry, that charge can be neutralized effectively with an ionizer. If you recall the last presentation, one of the risks we think about and want to discuss is static charge buildup can cause particles to attract to a body. So things like germs can be adhered to your clothing, your gowns, whatever it is you're wearing. An ionizer can help reduce that. Basically, as you walk past an ionizer, if it's designed and implemented effectively, it can cause those particles to neutralize and actually fall off. And there have been some studies to show that. So it can be a very effective tool. Another area where an ionizer can be very effective is, a lot of medical devices are packaged in plastic packaging. When you open that packaging, you're actually generating a fair amount of static charge. If an ionizer is implemented at the point where that packaging is opened, you can neutralize that charge. So there are some places where it can be used. It's currently not highly used in healthcare environments, but it does have some very specific and very useful applications. Another one that's much more common, obviously, is humidity controls. And in a healthcare facility, obviously, the environment is controlled for heat, cooling, and can be humidity. There have been some studies that have been shown that controlling humidity can actually limit the effect of infections or the spread of infections. There are certain microbes that don't do well in certain humidity environments. And that humidity generally is between, say, 40% and 60%, or some down to 30% to 60%. And that humidity range actually is a very useful range for also controlling static. So if a healthcare facility were to implement humidity controls to help limit the spread of infection, those same humidity controls in the same range would help limit the generation of static. And it can be a very effective tool. As many of us know, we experience shocks in the winter, but not in the summer, and that's because of humidity. The final thing that we talk about a little bit, and this is very, very case specific, are just simple procedural measures. So, you might not have some of these other, or the ability to implement some of these other mitigation strategies. And so you're generating shock. And let's say a doctor is going to implement a procedure on somebody. They might discharge themselves first, say either on as simple as a doorknob or a filing cabinet, just to make sure they're not going to discharge into their patient. That's a very simple, crude procedural measure. There are other things you can do. For example, when you have tablets where you may be collecting data out in the area, out in the facility, and bring them back and dock them. There are things you can do in terms of grounding those properly before you attach to the docking station to help mitigate the opportunity of a discharge happening through the device and causing data corruption. So every device is going to be different. Again, this is going to be very case specific, but there are things you can do to just kind of control the environment and control the risks that might happen. So those are the basic things that you can do in a healthcare facility. They're the things that will be discussed in this document, and they can be very effective. So just as a last little thing, again, this is work that's being done by the ESDA. The website, www.esda.org, has a lot of really good, useful information on static, what it is, how it's generated, how to control it. There's sections or pages on the site that discuss what the different working groups are and what they do. The healthcare group is Working Group 29, and that's the group that is preparing this document to help healthcare facilities.